Everybody for joining us for this endorsed expert webinar series. My name is Drew Wolf, and I have the pleasure of working with our endorsed business partners and our endorsed business partner program. So super high level. I do a lot of road trips and I talk to a lot of individuals, and those hospitals tell me what's going well or what's not going well. And we try and find trusted, vetted solutions that can help us solve some of those problems in Minnesota's hospitals and health systems. And a little over a year or so ago, we were out looking and hearing we had some insurance needs, some employee benefit needs out in the field. And so we went out and we did an RFI process and determined that the AssuredPartners team was a team that could really help Minnesota's hospitals and health systems. And today we have two individuals, Brenna Dooley and Lisa Talcott, who will help us walk through, is it time for an employee benefit refresh? So before I introduce them, just a couple of housekeeping notes. This webinar is being recorded, and we will share the link to the recording with everybody who registers here today. And we will also send out a copy of the slide deck once the webinar has concluded. Feel free to use the chat and the Q&A box if you've got questions throughout. We'll be monitoring and happy to answer any questions that you have as we go along. So with that, let me introduce Brenna Dooley. She's got over 2 decades of employee benefit consulting experience, does a lot of tailored benefit solutions, and she holds the Group Benefits Associate designation earned through the International Foundation of Employee Benefit Plans. And Lisa Talcott's got over a decade of working with CFOs, HR teams, and other leadership to help make informed decisions on their benefit programs. And Lisa currently serves as the president of the National Association of Benefits and Insurance Professionals in the Minnesota chapter. So with that, I'll step back and I'll let those two take it away and run through, is it time for a benefit refresh?
Great. Thank you, Drew. And we, first of all, appreciate you all attending today. We have a lot of content, and we've intentionally designed this to stay pretty high level on most of this information. We'll dive a little bit deeper into some areas that we know are hotter topics than others right now, but just to be respectful of everyone's time, we're going to touch on a lot of different things, and always are happy to schedule some one-on-one time with any of you that might want to talk or discuss any topics in a little bit more detail. We think this is a great time for a refresh perspective and just kind of taking a little bit of a step back, because most employers do renew January 1st. And if you're going to implement any major changes, you almost need a good, 6 months or more to really evaluate any change and really, what those items are that are going to have the biggest impact to implement in time for your next renewal. Even if you're not a January 1 renewal, you might renew mid-year. I think it's still a good time, at least once a year, maybe even a few times a year, to just take a little bit of a step back and understand, what your employees are looking for, maybe some gaps in your program. So that's really the intent of the information that we have put together for all of you today. And you'll see a little bit of an outline here in terms of the conversation that we're planning to have. We welcome any questions throughout. So while you'll see here, kind of the last item that we've carved out some time for is just an open discussion or some Q&A at the end. If you have anything that, if you're like me, when you hear something and you have a question, you want that answered immediately, just put it into the chat. We'll monitor that and we can tackle those as we work throughout. If you don't want to wait till the end, that's perfectly fine. So with all that said, we'll kind of move into the information here. And just very quickly, Drew gave a great overview of Lisa and my background, but just taking even a little bit of a step back in terms of who AssuredPartners is. As you'll see here, I'm not going to read through all of this, but I think really the main theme is our focus and dedication to hospitals and healthcare organizations. We really do build our services, our models, the tools, resources, the vetting of programs. It's very much tailored to hospitals and healthcare. And while Lisa and I focus mostly in the Minnesota and Midwest area, AssuredPartners specializes in hospitals and healthcare organizations across the country. So it really is, in our opinion, the best mix, the best balance of local servicing. We're in touch with what's going on, in your area, but we have that national reach to know what programs are up and coming and what are we seeing trending, not just from a local perspective, but nationally as well. An overview of our consulting team is listed here. This is not all encompassing, but because Lisa and I are going to walk you through the information today, we're up here. We also have Tom Seltz on our list. So even though Tom's not joining us today, we're going to talk about compliance, and he has been so integral in helping our hospitals navigate through the complexities. You all are a little bit different by nature than than other employers. You have lots of different dynamics. You have different employee categories, PRN, just a lot of things that can really go into the mix of from a strategic perspective, but also remaining compliant with all the never-ending rules and regulations and modifications in those that are occurring throughout the years. So our team collectively, as you can see, we have a great deal of experience, and most of that, as I mentioned, has been really tailored to and focused on hospitals. And we're going to touch on a little bit more about what that means when we get into these topics, and again, how those nuances and those differences really do impact the approach to your employee benefits program and consulting. So moving into employer expectations, as Lisa and I were going through the just never-ending number of topics that we wanted to throw in here today, we knew we had to scale things down, and this really just came top of mind in terms of I do think that the conversation is different today than it was even 5 years ago. If we were to have discussions with employers 5 years ago about what does a broker consultant look like, it was more about, we want to take this stuff off of our plate. We want someone else to handle it. We want to know that someone's taking care of it, they're on it, and we just don't have the capacity to do it. So we want an expert in that role. And while that still holds true, I think that the other big piece that has really evolved in the last 5 years is employers are also looking for a partnership. It's not just about come in and tell us what our renewal is, tell us what we need to do, where our gaps are. It's more of a let's be strategic, let's collaborate. You as the employer have a much better grasp on what you're hearing from employees in terms of, are there things that maybe they're not quite as satisfied with in your program, other things they absolutely love that you really don't want to change. And all of that really, I think, takes both parties to come together and achieve the best results within your program. So that is, I think, first and foremost, what we have focused on at AssuredPartners is being a partner in the process. We will come with recommendations. We'll do the heavy lifting to vet and take your information, take what we're hearing from you. But at the end of the day, we also want to do that along with your input and getting to that end goal. At the end of this, we're going to talk a little bit about long-term goal strategies and goals, as well as short-term, and how that all kind of plays into what I just mentioned. Cost containment, this has always been, I would say in the top 3 in terms of conversation, but as I think probably each and every one of you that are attending today has experienced, it is getting more and more difficult to manage costs, especially when it comes to healthcare. We've got now have pharmacy, a lot of different things that are impacting employers and the ability to have a sustainable quality program at the lowest possible cost. So we're going to touch on a few different things within here that really speak to some of the levers that can be pulled in terms of cost containment. I would say one of the number one questions that we get is, what's happening in employee benefits? What are you seeing? What are other employers doing that maybe we're not doing? We have at least, I would say at a minimum, quarterly meetings to discuss both cost containment, as I mentioned above, but also trends and just different paths, different things that can be incorporated into your program that really do touch on how do we get you kind of to that same level as your peers, and that is making sure that you remain competitive. We're going to talk about insights into benchmarking later on as we get into this, because I think that's a key part. If you are not benchmarking your plans today in terms of cost, plan design, et cetera, that's probably one of the most vital, I would say, in terms of understanding your benefits and how you're comparing to your peers, but also even just from a geographical perspective. I've touched on this already from the partnership approach, making sure that we really are that partner to help you sort through all of the programs, all the point solutions. I would venture to guess that every one of you on this are getting multiple emails, probably on a daily basis, in terms of, this is the newest disease management program or wellness strategy. Just you name it, there's something out there for just about every category. So understanding how to navigate that, if there might be 5 different vendors or carriers that are providing the same solution, which ones are other employers using? What have our experiences been from a broker consultant, even from a national perspective? So we're able to bring that to the table. And then compliance confidence. We did pull a few different compliance related topics that Lisa and I will touch on here later on in the presentation. And then I think that is probably one of the biggest areas that employers are looking for just peace of mind and expertise in. It is just getting almost impossible to navigate through the compliance complexities, things that are happening at the federal level as well as the state level. How does it impact me as an employer? What does this mean for my plan? If, that can vary if you're fully insured or self-funded. So a lot of different aspects go into that. And I think that's one of the things that we do best, because we are so focused on healthcare organizations. We really have our finger on the pulse of what's going on and how to help hospitals navigate through that. And most importantly, remain compliant. So I'm starting off with health insurance because if you're in a renewal meeting with your existing broker partner, this is probably what you kick it off with for the most part, right? It is always kind of that top of conversation because it is by far, one of every employer's top expenses. And it's something that we're continuing to see different topics, different categories continue to contribute to the ongoing cost and the increase in costs. So when we talk about health insurance trends and strategies, we pulled 5 things to the front here. And I think this first one is pretty compelling in terms of, there's lots of different stats out there in terms of, how much healthcare costs are increasing over time, what's driving those costs. But this stat that I came across, I thought was just kind of really put it into perspective in terms of, employers are expected to spend 50% more on healthcare than they did in 2017. So that's not a lot of time to increase by that significant of an amount. And as I mentioned, we are continuing to see a lot of things contributing to continuous increase in costs, pharmacy being a large part of that. On average, we see pharmacy being about 30% of total healthcare costs. Sometimes we see that upwards of 40 to 50%, depending on the drug mix. Some of you might have higher cost claimants that are on a specialty drug or a newer drug that are contributing to those, but also GLP-1 drugs. Most employers are covering GLP-1s, at least for diabetes. And so for that reason, we're also seeing that category of drug spend really, really start increasing over the last couple of years. So going back to this 30% number, and again, I'll just kind of use 5 years ago as a frame of reference. That number was probably somewhere around 15 to 20% of spend. So we are seeing that really quickly increase and significantly so over time. So we will touch on pharmacy in a little bit more detail just because that is such a driver of costs. A couple other things that I'll just very quickly touch on. Preventive care, I think, that old saying, an ounce of prevention is worth a pound of cure. I think that is so true. And we continue to see that in terms of, that's probably when we get asked by employers, what should we be doing in the wellness category? You can go from A to Z and everywhere in between in terms of how much time and money you want to allocate to that. And I think a lot of that just comes down to your culture and what you're trying to accomplish. But I think everyone would agree that if you can really emphasize and start with preventive care, designating or choosing your primary care physician. Just start with the basics on some of that. And then we've seen a lot of employers recently start implementing some, I would say, a little bit of add-on approaches to that preventive care, like cancer screenings. There's a variety of different solutions out there for just some of those additional screenings and things that can be bolted onto a healthcare plan. The last couple kind of go hand in hand here, just analyzing your health insurance plan to look at everything from what's your funding strategy? Are you fully insured today, but maybe you're large enough that you've been considering self-funding, but you need to understand the risks or, really the risk tolerance for some of those other funding strategies that exist. Who's your carrier or TPA? What's that provider network look like? Does that fit with your organization? Is there any way to narrow that a little bit more for, just cost savings? And how much data are you getting access to? I think that's becoming more and more important to employers. Depending on the carrier, sometimes, and depending on your funding strategy, you may be getting, a significant amount of data, but is it getting you what you need? Is it telling the story that you need it to tell? So that's one thing that I think has become more and more important, is just that overall transparency and understanding what's going on within the claims of your population. And then lastly, just plan design evaluations. These really can have a big impact on your overall cost in terms of what plan designs are you offering, but also how are you pricing those plans from an employee contribution perspective. That's something we spend a lot of time and focus on, and our actuarial and underwriting team is very much involved in that conversation as well. But I think that's become more and more of, as we were talking about, kind of levers to pull, part of in the mix of things to consider and really focus on and make sure that you're establishing correctly. Pharmacy landscape. I'm going to roll into this pretty quickly because as I mentioned, we have a lot that we're touching on. So again, if you have any questions or you want us to pause and touch on anything as we're rolling through this, we're happy to do so. But just to keep going here on the pharmacy landscape piece, as I touched on earlier, it is just, I would say, something that has, is a new experience for everyone in the mix, right? There's just so much happening, changing, evolving. And beyond that, you've got these legislative changes that are happening. And a lot of these are happening on a state by state basis. They all look a little bit different. They might feel somewhat similar, but there's a couple differences between them. So there's so much that employers can do that's within your control. And I think there's a lot of that actually, and some that's not within our control. But if we look at the pharmacy landscape and we see, as I talked about earlier, just the increase in costs over the last several years, a lot of that driven by the specialty drugs. We're starting to see gene therapy and other things, popping up a little bit more frequently than we have historically. GLP-1s, I think, that's coming up on a daily basis in terms of what's going on with GLP-1s. How do we manage this? What are other employers doing? Maybe you're covering it for diabetes, which is the most common approach, but not for weight loss drugs. But maybe your employees are asking for it. So we'll talk about GLP-1s here in just a minute. But I think, all of these things, that's a lot to impact a pharmacy plan and to know what strategies you want to implement. We do spend quite a bit of time focusing on options within pharmacy, and what can be done to help control costs over time. We like to approach it from the angle of, if there are things that we're implementing or that we're bringing to you for recommendations to implement within a pharmacy program, we don't want that to mean that your plan members, your employee spouses and dependent children that are covered under the plan are going to feel like something has been taken away, or now they can't get the drug that they were on. These are more behind the scenes things, controls that can be put into place that, quite frankly, we're not seeing a lot of employers do, but have a huge impact on cost. So in the mix of all of that, depending on what your pharmacy strategy is, whether we call it carved in, if your pharmacy program is just attached to whatever medical solution you have in place, We also have a carve out strategy that means, maybe you're insured with, and I'll just say ABC carrier for your medical plan, but for the pharmacy solution, you are direct with a pharmacy benefit manager. So the benefits still integrate. The data is still shared amongst or between the medical and the pharmacy program, but it's just the ability for you to have more control, customization, flexibility. And I would argue that most importantly lately, it's been the transparency that employers are looking for. Understanding what component of my pharmacy spend is truly claims and what is going to other pieces. So when you're carved in, that's definitely, you have less insight into all of that. When you're carved out, you have a lot more understanding and insight and the ability to monitor and audit that pharmacy information. So that's become, I think, more and more of a driver for employers to look at that carve out strategy if it fits for their situation. The rest of these I've touched on already. I will highlight 340B for those of you that may be an eligible hospital for 340B. I would say when we talk to hospitals and are getting their input on what they're using, or I should say what their 340B strategy looks like, it's all over the board. We have some that are very comfortable. They feel like, they're really leveraging that as much as they can. And then we'll talk to some hospitals who are like, yeah, we're using it, but we think there might be a little bit more that we could be doing there. So if that's something, a category that you might fall under and want to have some more discussion under, we're happy to set up a time. But I think if you are, a hospital that's eligible for 340B can tap into that. That can make a significant difference. So just making sure that you are, you're being compliant in that area, but leveraging it to the extent that it can be. And the last one here, GLP-1 drugs. A couple pieces that we wanted to include on this. AssuredPartners has an entire white paper on this. Or I should say case study, really. I did take a slide from that, and you can get a little bit of an idea, a little bit of flavor for what that looks like. But, there are so many varying opinions on GLP-1 drugs and, whether they're cost effective, how much of an impact that they might have on long-term conditions within a population. So I think some of it's jury's out a little bit in terms of we're still waiting on some of that efficacy data, but I feel like regardless of what source you look at, and even, an objective source, not a PBM telling a pharmacy benefit manager talking, but just in general, I feel like the consensus that we're really getting lately is that I don't think there's a lot of argument that these don't have a long-term or may not have a long-term positive impact on health populations. If individuals can bring down their weight and eliminate some other health conditions, of course, there's side effects and other things. So, right, you have to balance and weigh that. But I feel like that's kind of the general consensus that we've been hearing is that, most are on the side of the fence that these probably do help individuals over time, over the long run. If they can eliminate cardiovascular, they can reverse diabetes, et cetera. But I just want to highlight this, and it's underlined here towards the bottom here. The costs of these GLP-1 drugs would need to decrease by about 70% to really make these cost effective. So I think that's probably the biggest piece that employers and others are waiting for, is that decrease in cost, so that when we do look at this from an ROI perspective, it starts balancing out a little bit more. So again, lots of different aspects and ways to view GLP-1 drugs, lots of different opinions. I don't know that any are necessarily right or wrong. And for that reason, we wanted to share a little bit of just data in terms of who is the percentage of employers that are covering GLP-1 drugs today and for what reasons. So you're going to see up at the top here, 2023 versus 2024. There's a lot of content up here. I'll just focus on this first. But when we look at 2023 data, 49% of employers were covering GLP-1 drugs for diabetes only increased to 57% when the 2024 survey was conducted. And then 26% were covering it for diabetes and weight loss. That increased to 34% in 2024. From our book of business and from what we've seen, from an employer perspective, is many employers started to be a little bit more open to adding coverage for GLP-1 drugs, for weight loss drugs, in addition to diabetes in 2024. I think there was a lot more hesitancy in 2023, as you kind of see here. We saw a handful more that were like, yeah, we'll put weight loss drugs into the mix. A lot of that was due to employee feedback and requests. But we've had a lot that are pulling back in 2025. So, and that is purely based on what those cost increase have been on the health plan, on the pharmacy side. What we were just looking at here in terms of really needing those costs to come down to make sense. So really seeing that explosion in pharmacy costs in that, that diabetes and weight loss category when they're covering it for both, some employers have kind of just been forced to step that back. And I would say the most common approach today, to kind of sum that all up, is it's covered for diabetes. There has to be a diabetes diagnosis on file. Otherwise, it's not covered, and certainly not just for weight loss. This is always evolving. The new indications are being added for both of the, or I would say the two main GLP-1 drugs that are out there, for Ozempic and Mounjaro, but those are going to include cardiovascular, sleep apnea, et cetera. So a lot that's constantly shifting in this arena, but wanted to just at least share with you what we're seeing today in terms of these really being offered through the health plan for diabetes only. One thing that I did want to mention, and I just have a really brief note here on this slide, is we are working with a lot of organizations who are covering GLP-1 drugs for weight loss, but they are doing that outside of their health plan. So it's not impacting their true health plan spend, but it is something that they're able to at least offer a solution for employees or spouses who want access to these weight loss drugs, to still be able to take advantage of rebates, manufacturer's assistance, make that process easy for them if that's the decision they've made. And again, you can do that without impacting the health plan, but still bringing it to employees at a lower cost and helping them access that much easier than trying to figure that all out, navigate on their own. So that's something that I would say is kind of rising to the top in front of, in terms of trends in this category. We jokingly call this next section other benefits because, as I mentioned earlier, probably most of the time you're sitting down with your benefits consultant, it's health insurance, it's pharmacy, it's all the things that we've talked about so far. And then you kind of get the rest of the benefits. But honestly, these have become more and more important in the last several years. I would say, when it comes to looking at a benefits program, it's about a good health insurance plan, something that's as affordable and, as much quality as there can be in that health insurance plan to keep it sustainable. But then it's about what other things are we bringing to employees, because we have such a diverse work culture and work environment now. We have different demographics in terms of age, gender, lots of things in the mix. But I think probably the biggest driver here is just the age and the phase of life that each employee is in. That can be so different from what, a 28-year-old that you're hiring is looking for and needing and wanting than someone that's, nearing retirement and maybe they're empty nesters. So they're going to look at this from a very different lens. And so I think this first one that we mentioned here, voluntary benefits, it's gained so much attraction, and it really has become, I would say, a core part or a staple of employee benefits programs. So if you're not offering, the types of policies or plans that are listed here, accident, critical illness, hospital indemnity has been really popular for hospitals that have put that in for a variety of reasons, maternity benefits and even nursery benefits that we build into the policies for hospitals. They just really help round out your program, and they do that at no cost to you as the organization. So when we say voluntary, they are 100% paid by employees. We structure ours to have a dedicated service team so that it takes the load off of each of you, especially at each of your organizations, especially at the HR level. That's usually the first comment we get is, we love the idea of voluntary benefits. Maybe we offer, none today, maybe we offer one or two, but we just can't take on more administratively. This is really that is the reason that we developed the service model that we did, to say this is really a white glove approach that we take. If employees have questions on their policy, we always recommend they review it every year, review their elections to make sure, do I still need accident insurance? If I had that for, a child that was in sports and they're graduated now, maybe that's one I need to, get out of the mix. And maybe it's critical illness that I'm now more concerned with. So staying on top of that communication with employees, helping them navigate what fits best, but also answering questions about the plans throughout the year, helping with claims filings. All that is something that we take off of your plates, and we really take each and every step with the employees to work through all of those pieces. Non-insured benefits. A lot of times these are, I would say most commonly what we're seeing here, they might be point solutions that your carrier or TPA may have also for like buy-up options. But these are some, I would say, more popular ones that we've seen. I won't read them here, but if you have any, questions about kind of what we're seeing in this, again, we're happy to dig into that a little bit more when, if there were a one-off conversation. But for the sake of time, we wanted to throw some of those out there. Kind of family-friendly benefits, as you're seeing there, are probably at the top of the list right now. But I don't want to skim over the mental health, which is the next one listed there. That continues to be a big concern for employers. And I know from hospitals and healthcare organizations, you have even a little bit more of a challenge there, just by nature of what your employees are doing and experiencing every day. So EAPs, employee assistance programs, continue to be important. But we're also seeing some other pieces being incorporated, like designating mental health days and really bringing managers up to speed on awareness training, identifying issues, and where they can jump in to help as well. I want to touch briefly on the retirement planning assistance. That's kind of a broad category, but we have seen that shift, especially as we were talking earlier, as we see employers, getting older and reaching that or nearing that retirement age. It's a scary time. I think it's kind of that you don't know what you don't know. So they sometimes don't even know what questions to ask or how to help themselves prepare for that next chapter. And sometimes that means that maybe they're sticking around for longer when they really do want to be able to have that opportunity to retire, but they just don't know how to navigate that. So we build into to our service model Medicare education and assistance support. That's probably one of the first questions that we get from employees who are nearing that retirement age. What are my options? What if I were to retire at age 65? What does that mean for health insurance reasons? But along with that, you've got other things, retirement plans, et cetera, that kind of all go into the mix that are that we really collaborate with employers on to package that together and make that a little bit more of a uniform approach in terms of that overall support and education around those topics. Last but not least, and I know this seems super obvious, but from what we have seen and the feedback that we have heard from employers and employees alike, technology and the ability just in general to communicate to employees has become more and more of a topic in these last couple of years. There are so many different tools and resources that are available to meet every employee kind of where they're at in terms of their communication style. So you probably have in the mix some employees that are like, just hand me the paper copy. You probably are starting to see more that are saying, I want the ability to go seek this information out myself, give me a link, let me dissect it, learn a little bit more about it, share it with the spouse at home through, maybe an app or an online portal. Electronic benefit guides, we use those a lot. Those are really easy. They kind of break everything down into bite-sized pieces, but there's videos and other things to help supplement the education, because as we know, it can be very overwhelming. But that year-round education and communication, especially when you think about how much information we ask employees to absorb and digest at open enrollment time, you almost have to have year-round education and communication for them to understand the benefits, and really that leads to how much they value benefits. So I think the more they understand it, know how to use benefits, the more that they appreciate that, value that, understand how that impacts their bottom line. Everyone's favorite topic here, compliance. We really do focus that this is just a core piece of our service model, in terms of making sure that we're, covering everything compliance, state, federally. Some of you listening might be subject to ERISA. Others may not be subject to ERISA. So there's just lots of different approaches that employers take when it comes to compliance, and kind of, different varying degrees of how they're going about making sure they're compliant. As I mentioned, our goal is to make sure that the clients that we work with are able to sleep at night. They have that peace of mind that I've got this covered. I've walked through my program with a compliance expert, and we feel like we're on top of everything. And so before we touch on a couple specific topics, at the very bottom there, I'll just mention we do conduct compliance audits, and those usually happen every 2 to 3 years. Definitely at the starting point when we begin working with a hospital or healthcare organization, we're doing that first and foremost. It is to cover things like, are you subject to ERISA? Sometimes we find that they really haven't had a legal opinion on that. So starting there and then going through each of your benefits, your eligibility, how you're tracking hours. It's just a very in-depth, again, A to Z, going through every compliance topic and then reevaluating that every 2 to 3 years. We've seen in the last several years, I would say even starting with COVID, especially, just more turnover by nature, and not just for hospitals and healthcare, just in general. And so that's been a key part of, if an employer at the time that they originally, went through a compliance audit, or maybe they had an individual that had been there a few years and was on top of compliance, but now they have someone brand new in the mix. There's a lot of things that can fall through the cracks very easily, because there are so many moving parts to all of this. So that's another reason that we've really, shined a light on this and revisit it frequently, just to make sure that we remain on top of all that, and you as an organization do as well. A couple things that we're going to touch on very specifically here. The ERISA fiduciary responsibility, say that 3 times fast. ERISA fiduciary responsibilities that have to do with the health plan, fee disclosure, and pricing transparency laws. As you'll see there, it is probably the first of its kind in quite some time in terms of reform. The Johnson & Johnson legislation was, I think, the one that the piece that really kind of put this to the forefront, and has made employers look at this a little bit more closely. And I just included here some best practices from our perspective. And again, we talk about this being really ERISA fiduciary. We have approached this from a compliance perspective with our hospitals, and we work with many hospitals who are not subject to ERISA. So That said, there are still so many components of this that we would still consider best practices, regardless of whether you're subject to ERISA or not. We also want to be really careful that you're not, doing things like writing ERISA in your plan documents, or if a carrier is issuing you a summary plan description or a certificate, right, that it gives you an overview of the coverage within your plan. Sometimes they'll just automatically put in ERISA language. So watch out for that if you aren't subject to ERISA, because that can trigger you to be subject to ERISA, and that can trigger a whole host of other things that you need to be on top of. So I mentioned that because, again, if you are listening and you're not subject to ERISA, might be something that you check if you haven't taken a look at that, those carrier specific documents, making sure they're not citing ERISA language and regs within those docs. And then just some other things that we've listed here. The gist of this, I won't read through all of them, but I would say that the general idea here is you're doing the right thing. You're getting from your broker consultant what their fees are. That's that, annual requirement to disclose their fees. You want to have that on file. Most brokers, even the ones, we compete with, they're doing that, but just make sure that you do have that information, because if you're ever audited, that is likely a piece that will be requested. And in addition to that, what are your carrier fees within your various plans? The health plan is probably the biggest focus there, because we're talking much more significant dollars than the others. But again, the right thing to do is to do a periodic RFP, request for proposal, to really understand if your plans are competitive, if there are other lower cost alternatives that would, be the same in terms of benefit offerings and plan design, but at a much lower cost. So, and then the last piece to that is just documenting. We conducted this RFP in 2025. These were a few of the things that we evaluated, and the reason that we ultimately made the decision that we made to go with it, or either go with a different carrier, stay with the same one. All of that, just kind of documenting that, so if it ever comes into question. And again, you can look up the Johnson & Johnson case if you have want a little bit more. You're probably familiar with it, but if you want a little bit more context around the importance of this and why it is becoming more important over time. And then I don't want to get too far into the weeds here, but as I mentioned, when we talk about ERISA responsibilities, in this page is labeled ERISA plan at the top. Many of these components that are in this illustration here are going to apply to non-ERISA as well, from a non-ERISA organizations, from a best practice perspective. And what I mean by that is a lot of employers are not aware that they need to have a plan document on file. So this is if you're subject to ERISA, your governing plan document, which is something you create and establish at the employer level. It's not a carrier document. But this is so important because it has protections for you as the plan sponsor, whereas all the carrier documents, the certificates of coverage, et cetera, are mostly going to have language in there that is more protecting them. So you want to make sure that you're protecting yourself as well. So the ERISA plan document is going to have ERISA language in there. It's going to have that protection language for you. But there's a version of this that we help you create that does not reference ERISA, but still has those protections in place for you. So in the instance of, possibly a lawsuit or something, a complaint that arises, you have something to really, provide that protection, back up your position more so than if you just had carrier documents. So it's required if you have ERISA. It's what we would highly recommend even if you don't. And then kind of you'll see the underlying documents and how all those pieces kind of fit together. But I wanted to mention that because that is something that does impact. It impacts all of our hospitals in one way or another, but even if you aren't subject to ERISA, it's something you might want to be thinking about. All right, Lisa, I'll turn it over to you to talk about the Minnesota paid leave topic.
Thank you, Brenna. Yes, many of you probably have heard about this. There have been various webinars that the state has been putting on to update employers about their responsibilities for the new Minnesota paid leave laws. And in fact, there's one that they're running right now simultaneously with this webinar. So the high level on this is that effective January 1st, 2026, all employers are required to have a 0.88% payroll tax that is no more than 50% covered by the employee payroll deduction. The employer can decide if they want to cover the full amount or have the employee cover up to 50% to fund the Minnesota paid medical leave program. And that benefit provides employees with up to 12 weeks of paid leave for their own medical condition or needs. And then separately, up to 12 weeks to care for a loved one's or family members' medical condition, not to exceed a total combined leave of 20 weeks over the course of a calendar year. So one note there is that the definition of who qualifies as a family member or a loved one is very broad. It could be anybody who would attest that you take care of each other or that you take care of that person. So it's very broad and neighborly, if you will, is the stated intent on the part of the state of Minnesota. And so the key milestones are listed here. 2024 was when the public comment on rulemaking occurred. And you probably are already familiar with the quarterly wage reporting that happens through the unemployment portal, which will also be the same wage detail data points for processing and managing the paid family medical leave program. And then the initial equivalent plan guidance was issued in December of 2024. And basically what that means is it's private plans that are approved by the state and compliant and allow you to opt out of running the program through the state. So that obviously produces the question of like, well, should we run this required program, Minnesota Paid Family Medical Leave, through the state, or should we run it through a private insurance policy? So that's the big question and the big decision that every employer will be needing to make. And well, the state has most recently produced and published a calculator so that you can determine what that would look like through the state from a financial responsibility. The carrier equivalent plan approval process is still in progress. So carriers are offering, in some cases, illustrative quotes, in some cases, formal quotes. You know, the key here with these equivalent plan applications is that these carriers have been managing FMLA, PFMLA, and other state programs in the other states that preceded Minnesota. So about a dozen. And these carriers that also manage, short-term disability, long-term disability, and other benefits of that sort have already invested in the technology and the service levels to take this on and have a streamlined experience with member support to process claims. So, filing those plans with the state is kind of where it's at with that. I know for some of our clients, we've been able to get illustrative quotes, and then we have put together a calculator to show a side-by-side of like, well, here's what your rate is, and here's what your cost would be if you run it through the state with your minimum obligation that the employee contributes 50% of that premium tax. And here's what it would look like if you ran it through a private plan and you'd have a streamlined experience. So again, the member experience is going to be was expected to be very smooth because these carriers already have all the systems in place. And with the state, the state is building on what they have learned from other states, although Minnesota has very unique provisions for how it's managed, and it would all go through that unemployment portal. And so as an employer, you would not be, if you go through the state, your employees would not have your advocacy or support like they would if you go through a private carrier. But as far as analyzing the budget impact and the possible different permutations of, we want more of this, or we want more of that, or the state covers 90% of the lower income wage earners, and then they have a graded scale of lower and lower percentages the higher and higher the salaries are. Well, that obviously impacts how you make your decisions about who is going to get what coverage, through the state program or through supplemental short-term disability insurance. So those are all conversations that are pending, but we can have some of those initial calculations happen at this time. So as you can see, 2026, the payroll deductions start on January 1st, unless you've completed the opt-out process, which involves, again, the state hasn't released the full guidance, but it'll involve an application fee and an approval process with a compliant and filed and approved plan. And then the leave and benefits are available to Minnesotans starting January 1st, 2026. For groups that have under 30 employees, there's small business assistance. And then the first quarterly premiums are due on April 30th, 2026. So there are a lot of moving parts with this, and it's different than any other state, and it's different than any other benefit than any employer has had. So, it's kind of a rework for everybody that is going to include reporting and the premiums and how that works with the payroll deductions and wage reporting, educating and informing employees, whether that's part and parcel of your overall benefits program, or if you are sending them to the state for that part of the program and what that looks like. The leave administration, this is a huge area where everybody's going to have to rewrite their handbook, because whatever policies you have in place for PTO, vacation, earn safe and sick time, and whatever other internal policies you might have, maybe you do self-insured, short-term disability for up to 8 weeks or something like that. It can run the gamut and be highly variable. Well, incorporating this paid family medical leave to make sure you're compliant, and then how are these policies going to overlay? Is there supplemental coverage for different salary levels? How are these employees going to be treated? That all has to be documented and clarified in that employee handbook. And then collaboration and improvement over time. I mean, obviously you can see this is content from the state. So that's part of their process for wanting to work with employers to improve their program over time. So I would say at this point in time, the 3 things for employers to focus on right now, the highest level, is what is the intent of the benefits offer? What's our philosophy? What's our recruiting, retention, total compensation, our approach to culture? And the way I like to think of this is, what conversation do I want to be having with my next top recruit, or to keep my best person in any given department? And that can kind of, understanding that from the different stakeholders in your organization is really where you can develop that philosophy around how are we going to treat people, and how are they going to perceive how we are responding to this requirement for all employers. The next point here is that the paid family medical leave census includes all employees, not just benefit eligible employees. It's part-time, seasonal, and it goes all the way down to anybody that has made more than $3,700 on your payroll in any given calendar year. So the threshold for who qualifies is very low. And if you have a lot of part-time people, this is a big deal to understand how to, basically run that analysis, like I was saying earlier, about who you need to cover and what the rates are, and comparing with a carrier to going through the state directly. And then, as I always already mentioned, the employee handbook updates is going to need to be very clear for every class of employee and how it affects them. And as I mentioned, and this is kind of in the details, those higher income earners are not going to have as much coverage through the state, because the state's program has more coverage for lower income earners. So how you supplement that, how you address the gaps, if you will, for income protection if you're too sick or hurt to work, and how that all flows through various timelines and sequences has to be documented clearly in your employee handbook. So the website is here, the info.paidleave.mn.gov, and there's more information forthcoming. But if anybody has more questions or just wants to see how they would shape up right out of the gate with what we know now, that's something we can help with.
Great. Thanks, Lisa. That was a nice summary of a lot of moving parts there. Just very quickly, I know we have 3 minutes left, so and we promised some Q&A, so I'm going to hit these last couple topics. I've actually touched on them a little bit already, but just I would say from a benchmarking, shifting gears a little bit to benchmarking your plan designs, your costs, how much you're paying for benefits, how much your employees, the portion that your employees are paying. This is something that I feel is becoming really just part of benefits consulting. So if you don't have this information today, or you're not using it alongside some of that decision making, to kind of check your benefits package against your peers, or even again from a local perspective, that's something that we can help with. Let us know if that's something you're interested in. And then the last thing that I would say, we've talked about so many different things today, but I think ultimately what we have found to be really effective, and I think what employers value most, is having an action plan in place. And that's the shorter term, what things do we want to try to implement in a year? What things do we know might take 3 years? Maybe even what's our 5-year or longer plan in terms of where we want to get to, and have every representation at the table, from the leadership perspective, financial, HR, in terms of coming together on that plan. And then most importantly, measuring the progress and tracking the results of those over time. That's how you're going to get there. That's how your benefits consultant is delivering on all of the promises that you combined have established, and your team as well. So that's something that we think is really key in kind of keeping everyone accountable and moving. With that said, we're going to pause here. I don't know if there's been anything put into the chat yet, Lisa. No, nothing in chat. So
No.
would love to open it up for some Q&A. And Drew, I see you're coming back on too. So
Yep, we can certainly unmute people if that's helpful too. So if you have any final thoughts here in the last minute or two, please send them in for Lisa and Brenna. But otherwise, I'll just remind everybody that we'll be sharing today's slides in an email follow-up with all registrants here in a little bit. And we'll also share back a recording of the webinar, so that if you have others at your organization that might want to see it, or there's a part, GLP-1 drugs, for example, that maybe stuck out to you, you want to go revisit, you can speed ahead and see those different pieces. All right, I don't see anything, and I see we're right at the top of the hour. So Lisa, Brenna, thank you so much. Tons of information, lots to think about, building that employee benefit plan strategically. I think that last slide says it all. You gave us lots to consider, and thanks everybody for attending today. We appreciate your support in these endorsed expert webinar series, and we certainly hope you have a great rest of your Wednesday. So thanks everybody for coming today.
thank you.